And I want to start, doctors, with the example that's in front of you, Dr. Aishi, with the difference between a conventional implant and a mini dental implant, showing this jawbone example.
You guys, it's a huge difference. I mean, this is why we're so excited about mini implants. Like you could see here, this is called an osteotomy. This is the hole that we prepare in your jawbone in a conventional implant. And here is the hole for a mini implant. And I mean, you could tell the difference here. It's huge because this one is much larger than this one. And as a result, you could use this implant much quicker. I would love to be able to have the small hole compared to the large hole.
And even the procedure itself is so fast and less invasive.
Yeah.
You know, you can see on the osteotomy, we have to go through a much larger, longer surgical procedure, but when we do a mini dental implant, it's literally putting a pinprick into the gums.
Yeah.
It's literally several times faster, which again, as Dr. Aishi said, is faster healing, easier healing. Use it right away. Don't have to wait 4 or 6 months before you can even start using the dental implant.
Right, right.
Months and months can go by with a conventional, and I know you've placed conventionals, and now the minis are a part of your practice, but the fact that the titanium post can go in, you don't even need that much bone to hold it.
No, we don't. In fact, when we are actually placing the implant, the first mini implant that Jared and I ever placed, I remember we've been doing conventional implants for 14 years.
Yeah.
We did the mini implant and we're like, wait, that's it?
That
We're
was
done?
it?
It was so quick.
Yes, yes, it absolutely was. And again, because the way the design is, you can start putting things on it immediately. Where with conventionals, you know, as John, you said, you have to wait minimum 4 months, 4 to 6 months sometimes before you can start utilizing those implants. But we can that day, within 5 minutes, start loading these mini implants and putting things on, whether it's a denture, a bridge, a roundhouse. You know, and in a world where time is everything, time's the most valuable commodity that we have. Being able to get your crown, your bridge, your roundhouse, your denture that day, it's just incredible.
And you know, you can see how small the hole is here, you guys. You don't have to have, like a lot of people out there have had dentures for a long time and they just kind of give up. They're like, you know what, I would love to have an implant, but I don't, you know, I've had other doctors tell me that I can't get one because I don't have enough bone there. Well, if we're doing this kind of hole, yeah, you don't have enough bone. But if we're doing this small hole, look, I mean, if you've had dentures for 10 years, you know, your bone kind of disappears. Well, a mini implant might be able to help you because you don't need that much bone because you have such a small hole here.
And I know the bone will grow around that titanium post to even make it even stronger. I want to show what swims around in the bottom of your gums, causes great discomfort, gives you fear that it's going to fall out, and I'm talking about the lower denture. And the mini dental implant is going to save this denture in a way like you won't believe.
The wretched lower denture. Like, you know, what we don't think about is this big muscle in your mouth. Okay, it's not your jaw muscles, it's actually your tongue. You know, that's how you get the shape of your jaw. It's that big muscle called the tongue. And when you get a lower denture, you're right, it flies all over the place. So, you know, you can see here, look at the small little buttons right here, you guys. I mean, there's super tiny little buttons right here, and we have 4 implants here, and a small ridge, and here's the denture, and the underside of the denture. And you have these little shock absorbers underneath the denture. And look, it buttons right in like this.
Snaps into place and it's stable.
It's not going anywhere.
When you convert your lower denture to a mini implant retained over denture, you can say goodbye to goop.
Yeah.
You're not using that anymore. It's being snapped in on button snaps and it's locked in, and you can be confident. You can eat the foods that you want. You don't have to worry about your tongue pushing out when you're having a conversation with somebody. It is an absolute game changer for lower dentures.
If you have a lower denture, you probably have an upper denture. And we talked about the foods, you know, that we love here in Michigan. I want to show you why the upper denture and why the mini dental implant works to bring that sense of taste back. Show us why, because some of the plastic is removed as a result of the mini dental implant.
With a conventional normal denture that's not on mini implants, it covers your entire palate, and that's part of how it stays in. It creates a suction. The moment we place mini dental implants in your upper arch, we can that day, within minutes, bore out, carve out that entire arch and expose your palate and your taste buds, and all that taste you've been missing for years instantly comes back.
So dentures are one thing, but let's talk about the next step up for a mini dental implant, and that's what we call the fixed on 6.
This is like having your natural teeth back. There's nothing here. This is like just snapping teeth back into your gums. And it's just a little bridge that's fixed on 6 mini implants. You have your little shock absorbers.
Your teeth normally have, to get technical, what's called a periodontal ligament. It's shock absorbers around the teeth, so they flex a little bit when you eat. And with the Fix on 6, this innovative solution, we're actually giving you a porcelain zirconia bridge that will last you the rest of your life. Looks and feels like natural teeth, no plastic involved. That goes on and doesn't come off, stays in your mouth, and has shock absorbers. So when you chew, it's the first prosthetic solution that actually has more of a feel of what your natural teeth once did. The really cool thing about the Fix on 6 is it's semi-removable. As a patient, you don't ever take it out. Every 6 months when we bring you in on a maintenance program, we as the dentists, and as our team, we pull them out. And we can clean them, we can change the shock absorbers, the O-rings as we need to, and do any minor maintenance at that point. Snap it right back in. You don't take it out. You sleep with it, you live with it, you eat with it.
Yeah, and you can see here, like we don't have any material on the front here that's going over your gums. It's actually just teeth. That's it. And it buttons right into these little implants here. A lot of people love this because they have nothing around it other than just this like bridge that snaps into place.
There's a step up from what we just saw, and this is called the Roundhouse, and it's a permanent solution, isn't it, doctors?
Yeah, so this is the permanent fixed Roundhouse. So some of you may have heard of All-on-4 or Teeth in a Day, and that's where they place 4 conventional implants, remove a whole lot of bone doing it, and do a permanent fixed solution. So this is the competitive product for the All-on-4. This is a permanent cemented in solution. You do not take this out. You have some patients that they don't want to ever take it out. They just want it in there. They want that peace of mind. Sometimes it's a mental thing. We place a few more dental implants for more retention, and you're going to cement this on. And it's a true full arch tooth replacement. Looks and feels, as the Fix on 6, looks and feels like your natural teeth. There's no plastic. It's tooth-colored porcelain, ceramic, and steel under there. And blends in beautifully with your gums and your dentition. We choose the shade you want, but it's in there for the rest of your life.
Yeah, this baby ain't coming out.
And you go in for your treatment just like you would any dental care.
Yeah, absolutely.
But it's just there forever.
Absolutely.
Yeah.
And you can do this with an upper or a lower, and you'll prep the patient for this, and you could do both even. It could be upper or lower.
Absolutely. It gives you between the Fix on 6 and the fixed Roundhouse. Life is about options sometimes, right? And we can cater the solution into what the patient wants at that point, and what we're able to provide.
Let's talk about the teeth that are in the back of your mouth. Those teeth are the workhorse teeth. They're going to be there to chew the food and get the nutrition out. Show us with the example here and why it's so important to keep those teeth in place.
Well, this is what's so cool about this. God made it to where there was 3 roots on our molars. And this is a molar right here. There's 3 roots on there. And the reason why it has 3 roots is because it takes all the pressure. So like if you're not replacing that molar, guess where all that pressure goes? It goes straight to the front, those teeth that you love so much, we call them the social 6s, the big, bright, beautiful smile. Well, you know what the problem is? It's those teeth will start getting worn down. They may even start chipping. Or in worst case scenarios, they start getting loose because you haven't replaced your back teeth. And here, again, like little tiny mini implants, and this is a cementable, and we just cement it, boom, right on top of them like that. They're all splinted together.
In dentistry, there's 3 options to replace teeth. You can either do a removable, and most people don't like removables. You can do a bridge. The problem with that is you have to prep down the other teeth and touch the other teeth, or you can use implantology. This gives you the most minimally invasive solution to put mini dental implants. and put the same prosthetic bridge, multiple teeth, bonded on, cemented on forever, without touching anything else. It blends beautifully with your other teeth. It preserves the bone. It prevents your other teeth from shifting and moving. That's one of the things that a lot of people don't realize, is that a big reason we do dental implants or have just something there, even if it is a removable, is to prevent your other teeth from shifting. Because teeth like to fill in spaces. Your back teeth move forward, your top teeth move down. If you don't have something there with time, and it happens to everybody, it's not it's not an if, it's a when.
It's a biological
It's a biological process.
Yeah.
You want to keep your teeth in place, because if you don't, you will ultimately risk losing more teeth down the road.
Now, if you're out fishing on the lake and you knock a tooth out, or you're playing hockey here in Michigan like many of us do, this Made in America product, Made in Michigan product, will help fix this.
Here's a really cool thing, especially with Infinity Dental. This is the one, over the years, in the last 15 years in our partnership, we have taken pride in being able to develop in-house aesthetic, custom-made, custom-stained, same-day restorations. And we have a process very specifically with implants where missing a front tooth, you get one knocked out. We can place the dental implant. We can, with our CEREC machines, which allow us to do same-day final restorations on the spot, CAD-CAM create a perfectly shaped tooth. We have our own in-house custom labs where we match them exactly to your adjacent teeth. If you've got little white marks, if you've got little translucencies, if you got a yellow stain, we can literally on the spot in the final crown develop it on that mini implant, and that day send you home with a restoration that, quite honestly, we have a reputation for, that people cannot tell the difference. And instead of, versus the conventional implant, bury it, wait 4 to 6 months, wear a flipper, bring you back, go through 3 more procedures to get you that final end result.
Not going to come right out of a box and into your mouth. It's going to be custom made.
Right.
Absolutely.
And a flipper is an old TV show with a dolphin, and even Dr. Aishi remembers that. So here's what you want to do, everybody. You want to give Dr. Jared Van Indersum and Dr. Elias Aishi a call at Infinity Dental. The number's been on the screen, but I'm going to tell you what it is. 616-420-9175. And you want to go online to infinitydentalminiimplants.com, infinitydentalminiimplants.com, because Infinity Dental is all over Western Michigan. You go to the website and you're going to be able to make an appointment at the location that's nearest you with all the multiples that are out there right now. So make sure you write down that phone number, share it with friends and family so you can make your appointment at Infinity Dental. Now,